Hour number 2 of Need to Know with Jeff Angelo, your daily conversation of politics, pop culture, living in Iowa. Iowa is one of the states that in a recent legislative session, the current legislative session, we passed a bill and the governor signed it into law that basically allows what people are saying is an end run around the Affordable Care Act or Obamacare. What it basically allows is that a entity like, say the Iowa Farm Bureau can sell a leaner health plan that doesn't comply with Affordable Care Act rules and allows folks to buy that plan and not have to worry about the regulations of the Affordable Care Act. And you know what the problem is here in Iowa. On the exchange, there's one provider. If you want to buy a healthcare plan through the Obamacare exchange, there's one provider. So we are now allowing a plan to be sold. We're not calling it insurance that would allow you to have, I don't even know if you don't call it insurance, what do you call it? Just some help if you have healthcare issues and you can't afford the plan that's being offered in the the Exchange Act. Let's talk to healthcare expert Seth Denson, friend of this program on the Littman Law Newsmaker line, because I have a feeling just overall that with all this talk about Obamacare not working and repealing Obamacare at the federal level, that it's the states where the action's at. Seth, welcome back to WHO in Des Moines. Good morning.
Jeff, good morning, my friend. Thanks for having me back on.
So what do you think about this, Seth? I would imagine with the sympathetic Trump administration that these kind of what I call end runs around the ACA are going to start to be really in vogue in a lot of states. What are you thinking?
Well, listen, that they are. The challenge that we have here, and we know that the president wanted to get rid of the Affordable Care Act altogether.
Yeah.
So since it didn't happen from a legislative perspective originally, it's taking it apart piece by piece. And, the challenge that we have, though, is the devil is always in the details, right? And I like to think that I'm an optimist, but I'm also a skeptic. And so when you start to infuse, whether it's Wellmark or some of these other insurance companies into the marketplace, recognizing, as you and I have discussed a lot, that health care and health insurance are two different things.
Right.
Health insurance is just the financing mechanism. What has happened in Iowa, my fear of what's going to transpire because of this, is that it's just given a stopgap for health insurance companies to provide access to things that they know they can make money on, but really doesn't provide long-term protection to people that are purchasing this product.
Well, and the other concern, of course, Seth, is if you look at how Obamacare was constructed, younger, healthier folk are supposed to be buying policies. Maybe they feature some things that the younger folk don't need, but that was going to help out the folks that need the insurance and need the money over the long term. And this allows people to bail out on the Obamacare exchange. It actually, in trying to solve the problem, exacerbates the problem, at least on the exchange, doesn't it?
It absolutely does. And this has been the challenge since the Affordable Care Act was introduced and implemented, was that the Affordable Care Act in and of itself predominantly focused on the insurance industry and not on the healthcare industry itself. And so when you only focus on the financing mechanism but don't do anything to address the actual cost drivers within the system, right, then we have a problem. And what this is going to do is, and I get it, right, we need to get to a system that allows people to buy care or buy access to care in a manner of which they are, right? And so the problem with the Affordable Care Act, and I'll use an analogy here, was that it effectively said that everybody needed to drive a Cadillac. Right. But the problem is not everybody can afford a Cadillac.
Right.
And so the challenge that we have here and what we're seeing happen, and my fear of what we will see happen in Iowa and Tennessee, which are the two predominant states that have moved forward in these new kind of limited health care plans, is that we've said, hey, you know what, now here's a Yugo. A 30-year-old Yugo, go drive it. And it may get you from point A to point B, but if you want to get all the way to point C, good luck, because if something happens down the road, you're going to be in a challenged situation because these plans protect the finance companies from having to pay out if something major happens down the road.
Seth, this is why I like talking to you, because we get always back to the point of why we're having a national health care debate in the first place. which is the effect on your life, my life. And that is, I'm worried that long term I might get sick one day, like really sick, and not be able to afford the quality health care that's out there that could make me better. And it seems like to me, Seth, we're participating in the slow motion collapse of what the government tried to do under the Affordable Care Act before we finally get to that solution. Is that accurate in your eyes, or am I off base here and being a little too partisan?
No, I think you're absolutely right. The Affordable Care Act in and of itself was not the answer. There were parts of the Affordable Care Act that were admirable, and the hurdle is, or the challenge here is, the parts that were good about the Affordable Care Act, about not pre-underwriting and waiving pre-existing conditions, these are the parts that we're allowing right back in. And so with these things in place, listen, most of us will have health care expenses before we meet our maker, right?
Right.
And the challenge that we have here now is that the cost that we're willing to pay now in the future, because of the advancement of modern medicine, people live a long time while being sick, and they drive up costs. And the coverages that are now being allowed into the states, and the biggest part of this, and what I'm really terrified about what is happening and what got signed into law, is that the state of Iowa has said we're going to remove, because this isn't insurance, we're removing the legislation, the Department of Insurance's regulation over this. And so the fear is that now the power has been put right back into the insurance company's hands that is not considering itself an insurance company. They're pre-underwriting. They're picking and choosing the people they want. And if you get sick, you may not be protected in the long run.
Well, and the other part of this, Seth, is I'm like most of the people listening to this program right now. My health insurance is through my employer. When we continue to distort how health insurance is administered in this country, isn't the ultimate outcome going to be that my premiums are going to continue to go up because we're not allowing the health insurance companies to operate like health insurance companies?
Yeah, I mean, listen, until we start to do something about the cost of health care, premiums are going to continue to go up. The only way they won't go up is if the insurance companies are protecting themselves against paying those high-dollar claims, right? And so nobody's going to wave a magic wand and all of a sudden insurance premiums go down because until you address the driver of that, they won't go down. And so if they are going down, you need to ask yourself a very serious question: why?
To be suspicious of dropping prices. I know that's counterintuitively, but that would be a problem, right?
That's exactly right.
So, Seth, I always ask you this question, but I want to make sure that the listeners understand, because you're talking about we are not addressing what is driving healthcare costs in this country. What is top line the number one thing we could do to actually address that problem?
So while I am never in favor of the federal government getting involved from a business perspective of health care, one thing that we do request of the federal government is to put boundaries on things. So, for example, I used the car analogy earlier. Let me use it again.
Okay.
Right now, I can go buy a Ferrari that goes 200 miles an hour, but the government's not going to let me drive 200 miles an hour down the highway, right? They regulate how fast I can drive, even though I can afford the car. I can't, but if I could afford the car that would go 200 miles an hour, right? The government can set boundaries. They can set parameters, and within those parameters, make healthcare delivery systems be more transparent as to how they're pricing their delivery system. That is something that if we started to infuse transparency into the healthcare system, costs would go down.
That is Seth Denson. He is a healthcare expert that I always enjoy talking about because we kind of bring it back to how it's affecting the lives of you and me, this discussion of healthcare in this country. Seth, thanks very much for your perspective. Appreciate it very much.
Thanks for having me on.